Hey y'all, welcome back to the Girl Get Your Voice Back podcast. Today we're going to be discussing some pressing issues, okay? We're going to be discussing issues surrounding women's health, reproductive freedoms, reproductive rights, women empowerment, all of these things. And we're going to be diving into a very sensitive but a very crucial topic, and I want to talk about, especially in light of the current news which happened years ago. We want to talk about the negative side effects of the abortion pill. And this is a very important discussion that I want to have with you all, especially like I said, in light of current news with the whole tragic death of Amber Thurman, the ongoing political debates in our country with the legislation and the debates around what is good and what is not good legislation regarding reproductive health. We're gonna talk about all of it, okay? But before we dive in, let me ask you a question. I want to ask y'all a quick little question, and the question is, what if the very solution meant to provide relief ends up posing serious risk to your health? And I'm asking this question because I think sometimes we think things are good for us. We think that certain things are good, and we think it's going to be a relief or it's going to, you know, be beneficial to us. But then the harsh reality is that, sometimes relief turns risky. Sometimes what we believe to be relief can turn risky. And so I want to talk to y'all about the abortion pill. And when we're talking about the abortion pill, it consists of two primary medications, and that's mifepristone. And if I'm saying it wrong, it is what it is. Mifepristone, which is also known as RU486. And then the second pill is misoprostol misoprostol. Misoprostol. All right. Anywho, these medications, they're typically used within the first, 10 weeks of pregnancy, before a heartbeat and stuff can be detected, um, to induce an abortion, right? And while many women may choose this option, because they think it's what's best for them, they think it's safer than the procedure being done. It's vital for us to understand the potential side effects of the abortion pill. And it's vital for us to know the side effects and the risk involved when we choose to take this, not just from a spiritual perspective, but I want to really talk about the medical perspective. And disclaimer, nope, I'm not a doctor, but I can read the label just like everybody else, right? I can do my research. I have two master's degrees, so I am equipped to research. I am equipped to research information. We all are. We all have to be informed. We cannot depend on, medical professionals and things of that nature to give us all the information we need to know. All right. And so when it comes to these medications, I want to break them down for you all really quickly. Um, and I want to talk to y'all about the effects, what they are, what they do. Okay. Okay. So mifepristone, it blocks progesterone, right? And that's the hormone that is necessary for pregnancy, to continue, for the baby to be viable. However, it cannot be used in cases of ectopic pregnancy. I know a lot of times people be confusing abortion and miscarriages and ectopic pregnancies, but we're gonna talk about that in another video. And so basically, when the embryo implants outside the womb, that's an ectopic pregnancy. And using mifepristone in such situations can literally cause serious complications, can include a ruptured ectopic pregnancy, which could also lead to severe bleeding, right? And then you have misoprostol. Misoprostol. All right. So this pill is like taking 24 to 48 hours after the first pill, right? And this one, it causes the uterus to begin to contract and expel the pregnancy. So the first one is going to basically starve the baby of the nutrients. And then in 24 to 48 hours, you're going to take the second one, and that's supposed to help it expel, right? And so what happens when these medications don't go as planned? Because that's the thing that we need to address, especially in light of recent news. What happens? Because all medications have side effects, and I want y'all to really think about just average medications, right? Just your average medications. When it comes to how how do I want to say this? When it comes to like your regular Tylenol, when it comes to your regular high blood pressure pills, when it comes to all of these different medications that you take on a regular, when you go get the bottle of the pill out the cabinet or whatever, and you begin to read, there's a list of side effects, right? When you get the prescription from the doctor's office, there's a pamphlet attached to the prescription, and then there's a list of side effects, right? First thing first, I want y'all to beware when when they're telling you, oh, it's only two side effects to this. A whole pill, a whole drug that is going to help you to kill and abort a baby, to induce an abortion. You telling me it only got 2 to 3 side effects? Red flag, first and foremost, red flag, red flag. Okay. And when I hear things are safe, let me give y'all a quick little side story right quick, right? Okay. So during my last pregnancy, my entire pregnancy was cool, right? After I had the baby, right? They were like, oh, your blood pressure is high, all of the things. And they were like, we're going to put you on high blood pressure medication. And they had, I can't even remember the dosage, but I think I was taking like 2 to 3 blood pressure pills a day and all of these different things. And I was just like, nah, this is not my story. This is not my story. I'm not gonna do this. No, because how I didn't have high blood pressure until after this pregnancy, no. And so me being the person that I am, I said, I'm not taking this no more. And I remember going to my, check-ins afterwards, and the physician, he was like, hey, yeah, are you still taking, this medication? I recommend that you continue to take it for a few more months to see kind of how things play. And I'm like, oh no, I'm not taking that anymore. I actually have stopped taking it. Right. Well, I just recommend you keep going. And I'm like, well, I'm monitoring my blood pressure at home, and the thing is telling me that my blood pressure is normal, that is good. You're telling me I should keep taking this medication, and I'm looking at all the side effects, and I'm like, oh no, 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 no. Me, I can't be on high blood pressure medicine. Me, because I'm covered, because the blood, no, I can't do it. And so I stopped taking it. I come back to my next appointment and I had to change my doctor because you want me on medication. You want to check. It ain't happening for me. Okay. And so I switched my doctors. And so for my next appointment, she was like, hey, are you still taking whatever, Lobobodol, something? And I was like, oh no, ma'am, I stopped taking it some weeks ago. And she was like, good, because if you were still on it, I was going to tell you to get off of it immediately. Let me tell you, stop listening to just one physician. Get you some second and third and fourth opinions, because you have to understand how these systems work and how they don't work in your favor. Okay, that's just a side effect or a side conversation. I had to just put that in there, because sometimes they'll have you on medication. They're not even going through the side effects for you. They're expecting you to learn it for yourself. They're expecting you to read the bottle. They're expecting you to read that thick paperwork that comes with the prescriptions. They're expecting you to do your research, even though it's in their training to be able to communicate your options, to be able to communicate the dangers of all of the things. Just like when they go and you're having a baby and they're telling you, hey, these are the risk of you getting a C-section. And it could lead to, you know what I'm saying? They're telling you all these things, but you have to be mindful when it comes to certain things. They're not telling you all the risks, specifically abortion, okay? Or the abortion pill, okay? And so, yes, you have to take 2 pills within 24 to 48 hours of each other. And the first one, like I said, it blocks the progesterone that causes the pregnancy to continue to happen, right? And basically, it's going to keep your baby from getting what it needs, and it's going to end the pregnancy, right? And then the second pill is going to cause you to expel or to basically deliver the baby. That's why they tell you it has to be taken between 6 to 10 weeks of pregnancy. Okay? And so, as I said, what happened when these medications don't go as planned? Because, ideally, we want to believe that the side effects don't apply to us, that the side effects can't happen. We want to believe that, I can take a Tylenol, but I'll never experience a side effect. And that's not true in every case. Like, yeah, you can believe that. You know what I'm saying? You can stand on that. I'm all down for that. You know what I'm saying? I'm all down for praying over my Tylenol and all of those things. But the side effects are there to warn us that this is possible, that this can possibly happen to you. If you take this is a risk that you're willing to take. Period. Okay. And so here's the truth. While, many women have a safe experience with the abortion pill, while many women have safe experiences with having an abortion, there are serious risks involved when it comes to taking these pills, because they can lead to severe complications, particularly if the pregnancy is ectopic. But then even outside of having an ectopic pregnancy, these side effects can occur. And of course, they're going to tell you, you're like, oh yeah, the common side effects of abortion are nausea, vomiting. That's the side effects of pregnancy. You see what I'm saying? And so, the common side effects they're going to specifically focus on are nausea, vomiting, diarrhea. They're going to talk to you about abdominal pain, headache, fatigue. They're going to tell you that, fevers coming when you take this pill. They're going to tell you that, some vaginal bleeding. Obviously, the second pill is for you to expel the baby. Of course, it got to come with vaginal bleeding. Of course, that's a side effect of taking this pill, because how else is baby going to come out? Okay. And so they tell you these things because then you're thinking like, oh, okay, that's cool. That's good. Right. But there are more concerning, serious side effects that they don't really talk about that much. Right. And so you will see, like, if you experience a fever above a 100.4 degrees Fahrenheit, if you experience fainting, if you experience severe abdominal pain versus just regular abdominal pain, it's crucial, they'll tell you, to seek out medical help, to seek out medical attention immediately. They'll tell you to go to your pharmacist. What your pharmacist is going to do to help you? If you experiencing, you got to go to a doctor, hospital, an emergency room, right? Because then they tell you there's risk of other complications. And then you have these rare, but they're very serious, and they can happen to you. You can be the person that the rare happened to, right? Incomplete abortion, right? This is now going to require surgical intervention. And then there's heavy bleeding characterized by, big blood clots and the size of golf balls and all of the things. When they're going to tell you, when you're soaking through 2 or more pads in an hour for, consecutive hours and all of those things, that is considered heavy bleeding. They're going to talk to you about the allergic reactions, though rare, can result in symptoms like hives, difficulty breathing, all of the different things. And so these are some of the ones that they don't even tell you about, right? And I was going to get into like even the emotional and psychological impact, but I really want to talk to y'all really about even the case of Amber Thurman, right? And so for those of you who don't know, do I want to get into the emotional and psychological effects? No, I talk about that all the time, right? And so I want to talk to y'all about this case of Amber Thurman. And Amber, she is this, let me turn this off. Amber, she was a woman in Georgia, and she experienced severe complications after taking abortion pills, right? I think she had already took her second one. And based on the different news reports, because some people reporting the girl name wrong, God rest her soul. Amber, okay, let's get back to it. Amber, she reportedly was pregnant with twins, and decided to take an abortion pill to abort. Now, after taking these abortion pills, it is said that she began to experience acute severe sepsis. It also says that she began to experience significant vaginal bleeding after taking the second pill. Okay. And from there, she ended up going to the doctor, and it is reported that she was denied care. And the reasoning that they said that this woman was denied care was because of the Georgia's heartbeat law. We're going to talk about that, okay? Now, despite her condition, despite her reasoning for coming into the office, her medical providers denied her the proper treatment and health care that she needed to save her life, right? Now, I'm emphasizing her story because, for one, they're bringing it up in the news, even though it happened a year or two ago, right? But now they're trying to use her story to push an agenda, okay? And many of you are falling for it, and it's a shame. And you know, her story truly emphasizes not that this abortion ban is problematic. It doesn't emphasize that. It emphasizes the urgent need for timely medical intervention. It emphasizes the importance of having a knowledge and an understanding of the risk we take when we do certain things. It emphasizes the urgent need to understand that there are consequences to sin. It emphasizes the urgent need that although some symptoms, some side effects are rare, they can occur. It emphasizes the urgent need for us to understand that we're not exempt from bad things happening to us. It emphasizes the need for us to understand that misinformation is happening, and it's not normally the people who they're tagging as this is misinformation, right? You got to understand that the fact checkers got an agenda, and their agenda is to silence you from speaking the truth, okay? And so let's keep going, right? So this context surrounding her death, it brings us to the Georgia heartbeat law. I mentioned this earlier. And this law, it prohibits abortions after about 6 weeks of pregnancy. Okay. It prevents a medical professional from aborting your child. Okay. Amber's situation is very different from what this law allows. And I'm gonna see if I can pull up the full law for y'all. Okay. So the Georgia heartbeat law, it is officially known as House Bill 481. So do your research. Or the Living Infants Fairness and Equality Act, or Life Act, right? This law was passed in 2019 and went into effect in 2022. The law prohibits most abortions after about 6 weeks of pregnancy when cardiac activity or heartbeat, hence the name heartbeat law, can be detected in the embryo, not the clump of cells, in the embryo. Hence the term heartbeat law. At this stage, many women may not even know that they are pregnant, which makes the law restrictive. Okay. That's a whole nother thing. Okay. And so this law prohibits you from getting an abortion once the heartbeat can be detected. Okay. That's why the law says most abortions after about 6 weeks, because it depends on when the heartbeat can be detected. Okay. So we got that clear. And so this law has been the justification of why she died. Okay. We all understand it. Okay. Let me explain to y'all why Amber's situation is different. Amber, we all know this to be true. Amber took the abortion pill to now abort her twins. Okay? Can we just agree to that? Amber took an abortion pill to abort her twins. Amber then began to experience the side effects, the complications, the consequences of the pill, which now caused Amber to be in need of medical treatment. Can we agree to that? Can we agree to that? Can we agree that Amber health began to decline after she took the pill, not before she got to the emergency room? Can we agree? Can we agree? Can we agree that her issue of sepsis and severe bleeding was because of the pill and not because of delayed treatment? Can we agree to that? Okay. Now that we can agree to those two things, now we have to also understand the law prohibits a doctor from performing an abortion in Georgia once the heartbeat has been detected. Amber has already took the pill to do the abortion. So when we say that because this law is in place, Amber was denied medical treatment, it's a lie. Because the law doesn't prevent you from treating somebody who is presenting with severe vaginal bleeding and acute sepsis. It don't present. This law only prohibits an abortion. It doesn't prohibit medical treatment. Can we agree to that? Can we? Because sometimes we just like to go with the flow and like to go with whatever agenda is being pushed. And the truth of the matter is, her doctors delayed treatment because for whatever reason, they weren't performing an abortion at this point. She already did that with the pills. The effects of her decision is what she experienced, and they denied her proper treatment. And so when we began to say, oh, she died because of this abortion ban, it's a lie. It's a clear lie. This ain't even something you got to just kind of, you know what I'm saying, figure out. This is not no parable. This is very clear. She died as a consequence of her choice. And so this is why we have to speak up about the dangers of choice. I talk about this all the time. When it comes to choice, when it comes to free will, we also must take responsibility of the consequences that comes with our free will. We have to accept responsibility and be okay with whatever consequence that we receive based on the decisions that we make, whether good or bad. That's how free will works. When we go to the book of Genesis, and I said I didn't even want to get into this part. When we go into the book of Genesis, right, we know that Adam was told not to do something. Okay? Don't eat of this tree, but everything else you can partake of. Okay? Due to misinformation, okay, can we kind of see how this stuff is aligned? How we're continuously repeating history. Okay? Due to misinformation, due to deception, due to manipulation, now we see that Eve is deceived into now eating of the fruit that she is not supposed to eat from, eating from a tree that she is not supposed to partake from. And then she gives it to Adam. Now, because they have made a choice to disobey, because they have made a choice, a free will choice, okay, to do something that was warned of them not to do, now they have to experience the consequences of their actions. And the consequences of their action is, first of all, y'all finna get up out of here. Y'all gotta go. Y'all ain't even welcome in Eden no more because of what y'all have done. Not only that, there are other consequences if we begin to look at the book of Genesis. And I'm not going to go into that because I've done it in several other videos. There are consequences like pain in childbirth. There are consequences. And so when we think that we can make choices and not have to face consequences, we're already deceiving ourselves. And so when we're looking at this story of Amber, it's a consequence. And we thank God that he allows some of us or many of us to be able to come and we experience the mercies and the goodness of God. I know plenty of women who have had multiple abortions and have not experienced side effects only by the grace and the mercies of God. But in rare cases, that's not the case. There are people who have died from having an abortion. There are people who have had incomplete abortions and their babies have suffered from them. There are people who have experienced the adverse side effects of having an abortion. That's true. Whether they want you to believe it or not. Let me tell y'all something. I want to go to because people don't want to tell you the bad things, right? They don't want to tell you that this is very risky. They don't want to tell you that this is dangerous. They want to tell you what you want to hear, right? And so they'll tell you how this works. They'll tell you the effectiveness of the abortion pill. When you go to Planned Parenthood, they have a whole page devoted to convincing you that the abortion pill is good for you. That killing your baby is your choice. That killing your baby is the best thing to do for you. That killing your baby is effective and it is good. Okay? It gives you all the details that you need. It tells you why people choose to abort their babies. Right? This is your personal preference. This depends on your situation. Right? And guess what? Now we want to bring you a convenient option. So now you don't have to go to a clinic. Now you don't have to go to a doctor. You can do it by yourself. This is what they're telling you. You get to decide who you want to be with you during your abortion. You can do it alone. You can do it with your whole family. You can do it with 10 other people in the room. And it can be invasive or it can be very natural. This is what they're telling you on Planned Parenthood, right? And then they begin to answer all of your questions and they're telling you abortion pills are safe. Abortions are good. Abortions are okay until they are not okay. That's why this video, it says when relief turns risky, because a lot of times we see, man, now if I abort this child, I'm going to experience relief. I'm going to be able to do the things that I always wanted to do. If I don't have these twins, now I'm going to be able to live my best life. Now I'm going to be able to do my career aspirations. Now I'm going to be able to do my educational aspirations. But what about the case of Amber Thurman? She wasn't able to, not because of an abortion ban, not because of the Georgia heartbeat law. It was because she took abortion pills. And she just so happened to experience the rare side effects that they don't want to inform you about, that they don't want to educate you about. And so I ain't here to argue with y'all like I'm y'all mama. I'm just here to tell y'all that all misinformation ain't misinformation. I'm just here to tell y'all that sometimes the things that they're not telling you are the things that you need to be hearing for yourself. I'm just trying to tell y'all that what y'all see ain't always what y'all seeing. I'm here to tell y'all that there is an agenda being pushed to keep having you have babies and abort them. I'm just telling y'all that what we see is only an agenda and it is not for your reproductive freedoms. The blessing was already for you to have babies, for you to be fruitful and multiply. That is your freedom. And so then there's consequences when we try to go against, when we try to turn freedoms into something different than what it already was. But, I don't want to keep beating the hammer on the head. I just want to talk about, it's important for you to be informed. It's important for you to do the research for yourself, despite your feelings and your emotions, despite the enemy's lies, despite all of the things. You need to be informed about the potential risk that you run, whether it's an abortion pill, whether it's a regular abortion. You need to understand the side effects. You need to understand, and this is not to scare you, but you need to understand that you could possibly lose your life from having an abortion. You have to understand it. You have to understand that there is an agenda that wants you to keep aborting babies. You need to understand that this is a sacrifice. And we can't cry out about lives being sacrificed when other lives are sacrificed. You know what I'm saying? And so, thank y'all for coming to my TED Talk. Thank y'all for coming to this episode. I hope it shed some light on the complexities of the abortion pill. I hope it shed some light and truth about the Amber Thurman case that everyone is talking about right now. I hope it sheds some light about the Georgia heartbeat law that some of y'all probably have never even looked up to be able to fact check the fact checkers. Okay. And so if you found this helpful, please share it with other people who could benefit y'all. And remember, your voice matters. Your baby matters. And remember, all life matters. Okay. I will see y'all in the next video. Bye.